all Facebook friends. So my name is Dr. Sneha Balki. I am Senior IVF Consultant at Oasis Fertility, Pune. So today we are here for yet another Facebook Live session, and today we are going to discuss one of the lesser looked at problems in infertility. So what is secondary infertility? This is what we are going to deal with in today's session. So as we have discussed, what is infertility? So infertility is when a couple who has been trying to conceive for the past 1 year, where they have had regular intercourse and they have not had any contraception, but they are still unable to conceive. This is what we call as infertility. But there are two subdivisions in the main infertility part. So what is the first type of infertility? The first type of infertility is primary infertility, and other one is secondary infertility. So what is the difference between these two? When we say that a couple is suffering from primary infertility, that means that this couple has never had any conception whatsoever. So during their 1 year of duration of infertility, or whatever duration of infertility they come to us with, they never tell that in the history or in the past they have ever had any conceptions. So this is what is known as a primary infertility. Now, primary infertility is the more number or major component of the infertility as a whole, where at least around 60 to 70% couples are experiencing primary infertility. However, secondary infertility is one where the couple has conceived in the past, but that conception not necessarily be a live birth. So secondary infertility comprises of a couple who has conceived prior and they have a live birth or a living child or an infant they do have. So this is also in secondary infertility. Another can be that the couple had conceived in the past, they conceived and the pregnancy went on for a couple of months or some duration, but after that the further growth of pregnancy has not happened and it resulted into a miscarriage or abortion. So this is the second part where a fertilized cycle has resulted into an abortion. So even this comes under a secondary infertility. Third is if a couple conceives but the embryo after fertilization has failed to travel from the tube part and has not yet implanted into the uterine cavity. So this is what is known as a tubal ectopic pregnancy. So such a pregnancy is not capable of coming down into the uterus and having a successful implantation. So this also falls under a non-viable pregnancy, and it is also one of the cases which comes under secondary infertility. So all these things, when a couple tells us during the history that they do have a child prior, or they have conceived that child by natural ways or through treatment, and apart from that prior conception, if a couple tells us that they are having recurrent miscarriages or recurrent tubal ectopic pregnancies have happened in the past, then we classify them as a secondary infertility. Now, many a times we have to evaluate like what could have been the cause for that pregnancy that was conceived, but then it did not successfully continue, or it has continued and now they are not able to conceive. So, secondary infertility, again, we investigate that what is the current age of the partners, how much is the duration of infertility, like after a healthy pregnancy they have delivered, their child is now around 3 or 4 years old and now they are planning for pregnancy for the past 1 year, but they are unable to conceive due to some or the other reason. So what is the duration of infertility there? Or have there been recurrent abortions or tubal ectopic pregnancies where the tubes have been cut and subsequent pregnancies are however not happening? So these are the things that we need to investigate and ask them in their history. Plus, what are the things that we can ask the patients that will tell us that this probably could have been the cause of secondary infertility. So if a couple has been successful in conception prior, one would think like we had conceived previously, but then how come we are not able to conceive now? So what has changed or what is different between a prior conception and subsequently developing infertility? So there are many reasons. However, the reasons for a primary infertility and secondary infertility do have a significant overlap in them, such as there can be some cervical reasons, such as some dyspareunia or some infections, some cervical lesions such as erosions or cancers. Further up, we go to the uterus, and in the uterus, there can be some infection which has happened post your prior conception. This specifically we see when the previous conceptions have been an abortion, and there have been some products of conception which were retained in the uterus for a prolonged time, which probably got infected, or they required some intervention to remove those products of conception. So that leads to damage of the uterine lining, which we call as endometrium. And there can also be some infection if a proper aseptic technique of this evacuation is not followed, which also can be one of the reasons for not being able to conceive subsequently. Another thing is many a times such infections travel up to the tube and they result into tubal blockage and tubal infections such as pyosalpinx and hydrosalpinx. So the tubes which were once upon a time able to perform the act of fertilization are, however, now because of some infections or some blockages, they have lost their ability to allow the fertilization to occur. So they have lost their functional capacity and now they are not able to perform. So this could be one of the reasons. Now, when we see that previously there has been no difficulties in conception, but then subsequently what has changed? So what happens is probably you conceived initially when you were 29 or 30 years old, when your body had some vitality, the quality of eggs was good, the ovarian reserve was good, and down the line after 4 or 5 years, when you go and check, your ovarian reserve has declined. So this increase in the age or the gap between the first and second pregnancies is also something that determines what is your ovarian reserve at this stage. So ovarian reserve keeps on declining as we age, and along with the number of eggs, the quality of eggs is also something that goes on degrading along with our age. So, decreased ovarian reserve, low AMH, some hormonal imbalances which lead to non-ovulatory cycles. These all reasons are still applicable in secondary infertility as well. Apart from this, although time is more strict with women, but time affects men also. So maybe a person, the husband who was able to conceive previously without any treatments has now been having some difficulties, probably due to stress, or there has been some weight gain due to aging, due to diagnosis of some other ailments such as hypertension or diabetes, which is requiring some treatment. So all these things have a cumulative effect on your gametes, and the gamete quality and quantity might be on a decline, although not to a great extent such as what we observe in the females, but then males are also affected when the age is advancing. So such can be the reasons for a secondary infertility, which are common to primary and secondary infertilities as well. Now there are few conditions which are exclusively seen only when we see that a person is suffering from secondary infertility. So the same way, going from below to upwards, if we see that there might be some cervical lesions, then second is now the rate of cesarean deliveries has increased. So we observe that the scar of cesarean section has been weakened, and there becomes a potential space which holds on to your menstrual blood flow. So this your weakened cesarean section scar acts like a pouch where your menstrual blood flow, instead of getting completely evacuated, gets accumulated there, and further it might get infected, or even the discharge from that collected blood can lead to embryo toxicity and failure of implantation. So this is particularly in secondary infertility where the previous delivery has happened via a C-section. So this is what we call as an isthmocele, which we often find in couples who are struggling with secondary infertility. Another thing is like when the couple has conceived, but then due to some or the other reasons, the pregnancy has not progressed beyond a certain limit, and there have been some interventions in order to remove these products of conception. In such cases, the dilatation and evacuation of products of conceptions is an invasive procedure, which, if not done with proper aseptic protocols, can lead to certain infections reaching the basal segment of the endometrium, and the further developing endometrium then gets damaged, and a successful implantation requires a healthy endometrium, which is unable to be formed when such infections or some basal lining of endometrium has been damaged. Now, these infections can block, this intervention can block the tubes also. So, secondary tubal blockage can also happen. So, these few peculiar things are seen in a secondary infertility case. Now, whether it's a primary infertility or secondary infertility, if in secondary infertility we can find a specific cause which has led to non-conception after a successful conception in the past, then we should treat that particular reason, such as if we find that there's been some infection, then we treat that infection. Other than that, if we find that there is an isthmocele, we do a surgery known as isthmocele repair, which closes this potential space which is collecting your menstrual blood. Apart from this, if we see that there is some tubal blockage and these tubes are holding on to some infections, then tubal clipping can also be done. And these particular reasons, if we find such reasons during the history and the investigations, then we proceed and treat those conditions so that further conception can be possible. However, apart from these reasons, there are some conditions where there is no particular reason why the couple has been unable to conceive. So this falls under another category which we call as unexplained infertility, which is the same as in primary also. So in this situation, the treatment protocol or the options for fertility are again depending on the same criteria that we use for treating a primary infertility, such as what is the age of the couple, how much is the duration of infertility, and if any abnormal findings have been found in their investigations and history. So, if a couple who is under, where the wife is under 30 or 35 years of age and the husband is below 35 years of age, in this situation, we can definitely ask them to wait for a couple of months or maybe 6 to 8 months where they can try naturally or with some supplements. In presence of some findings in the history or during the investigations, if we do find that the ovarian reserve has declined or the semen analysis is showing some abnormalities, then we do give the treatment according to those findings. If, however, the age of the wife is more than 35 years of age, or the age of husband is more than 40 years of age, or if the duration of infertility is too high, too long, or the previous child is having a higher age, or maybe 7, 8 years of age, and now the couple has decided to try and conceive, but they are unable to conceive and they are worried about the growing age gap between the two siblings. So these are the scenarios where we need to speed up the process of conception, and this is the situation where if the tubes are patent, if the semen analysis is right, and the ovarian reserve is such that it allows us to give a few months of trial, then we can definitely go ahead for an IUI. IUI is a procedure where we allow the follicular growth, and once the follicular growth is achieved, we take a washed semen sample of concentrated good quality sperms and put it inside the uterus. So this increases your chances of conception by maybe 20 or 25 percentage. However, if we find that the semen analysis is quite abnormal or the ovarian reserve has declined very rapidly, apart from this, if there is any signs of tubal blockage or there is history of tubal ligation, because some couples do go ahead for sterilization operation immediately after their first or second pregnancies, and subsequently due to whatever challenges they might have had, whatever situations they face, they rethink their decisions, and they come to us saying that no doctor, we do want to conceive further. So in all these situations, we recommend to go ahead for an IVF. And in IVF, all these uh, whatever reasons could have been there can be evaluated in depth, and along with this it can offer a improved success rate and a successful pregnancy in spite of these reasons of a secondary infertility. So this was in short the topic today of secondary infertility. So I request you that if you do have any questions pertaining to this topic, please go ahead and ask. So we do have one question, that are there any risks associated with undergoing fertility treatments after having had a previous pregnancy? So the previous pregnancy outcome is what determines how aggressively we treat you for this subsequent pregnancies. So if the previous pregnancy has been a live birth where you already have a child or two who are doing well, who are healthy, and you do not wish to go ahead for an advanced treatment like IVF, then definitely you can just try with natural or near natural treatment such as IUI. However, if you have never had a live birth or you don't have a child yet, you have had only ectopic pregnancies or multiple abortions, in this situation, we do need to be aggressive and we need to have a fruitful live birth and conception. So, in this situation, there won't be any side effects as such, because your previous pregnancy, if we do find any reasons of failure of previous pregnancy, we treat those reasons, and then we work on how to achieve a healthy pregnancy this time round along with the treatment. So there are no such side effects pertaining to your fertility treatments after you have had a previous pregnancy. Another question is, if I have had undergone a C-section or other surgical procedures during my previous pregnancy, then can that affect my chances of conceiving again? So yes, just like we spoke, there are two things peculiar to secondary infertility, which is determined or which is the reason because of your previous pregnancy outcomes. So if suppose you have had a previous live birth where your delivery has happened via a cesarean section, the scar of cesarean section sometimes during the healing process does not heal well, and it becomes a weak scar. Now, this weak scar, although it's holding intact your uterus, but it generates a space where your blood, your menstrual blood gets collected, and this collected blood can be a source of infection and can be a source of your discharge. So, these reasons are something that can be found in secondary infertility when the lady has undergone a previous cesarean section. Apart from this, if you have had a previous abortion where you have had to undergo a dilatation and evacuation of products of conception, but because of maybe aseptic conditions were not followed, or in spite of following aseptic conditions, some infections has traveled inside the uterine cavity, and that has led to destruction of the basal layer of endometrium and blockage of tubes. So these two things can also happen if you have recurrent abortions and recurrent evacuations have happened. So these two things you have to discuss with your doctor once you approach for treatment after facing secondary infertility. So this was the topic for today. So today we have discussed the topic which is less looked after, that is secondary infertility. So secondary infertility is something that occupies almost 10 to 20% of all infertile patients, and they are also someone who go through a lot when they face this challenge. So if there are any further queries or you want a consultation regarding your fertility treatments, feel free to contact us on the below mentioned helpline. This is me, Dr. Sneha from Oasis Kharadi. Thank you.